So really, it's a great pleasure to have you over this morning for you, this afternoon for us. Annie Arnold, you are a third-year medical student at Flinders University in Adelaide, and you're joining us from a rural area about an hour or so from Adelaide.
Yeah, thanks very much for having me.
So Annie, we invited you today to talk about three things in general. So one is really, Australia is really strong in rural medicine, I'd say. Probably the country that's published the most papers in rural medicine. And we're in contact with several of your colleagues, your professors, and it's always been interesting to collaborate with you. And in fact, we did collaborate on this article you just published July 9th in the Rural and Remote Health Journal, very prestigious journal based in Australia, but it's an international journal. You published an article on basically, should we make mandatory training in point of care ultrasound in rural areas, in rural medicine? Right? That's probably not the exact title. I should have had the exact title. But first of all, I want to congratulate you on this.
Thank you.
And Annie, we're also going to talk about what is the experience of working in rural medicine in Australia, and also what was your experience in publishing that paper, but also how are you dealing with COVID right now in Australia? So we start off by asking people how they're doing. And so how are you today?
Me?
Yes.
I'm good. It's it's 5:30 in the morning, so no hard questions, please. But other than that, doing really well. And as Rick said, I'm currently doing a year-long rural placement based in the Barossa Valley, which is a wine region about an hour and a half from Adelaide. It's a very beautiful place. Spending a year up there doing rural general practice and rural emergency medicine.
So, Annie, why are you interested in rural medicine?
Quite a few reasons. I think the biggest thing that sort of drew me to rural medicine is just there's really unique challenges, particularly in Australia, to do with having a really, really wide geographic spread. So I think it's quite similar in Canada, but our populations are very, very densely located around the coastline of Australia, and then we have an absolutely enormous landmass that's not very populated, but we still have quite a few pockets of community spread out over that area. And so I just found it really interesting seeing how people, I guess, tackle the issues that are associated with having such a wide spread of populations across that area, and how you can improve access to healthcare for those people.
And how popular is rural medicine amongst medical students, for example?
I think it's quite variable. The university that I'm at the moment, they have a really, really strong focus on trying to promote rural medicine to their students. So the program that I'm doing at the moment with the rural year, I think we have about 40 or 50 students who sign up for that program. And they really do try and sell you on the rural lifestyle. They try and sell to you the benefits of going into a rural practice. I think one of our issues in Australia is that there are very different healthcare networks that service the populated regions versus the rural regions. The rural side of things is a bit more of a privatised system, and quite a few people are not interested in that, and so they might go rural for a few years when they're young, and then when they decide they want to settle down or start a family, tend to head back to a more populated tertiary centre. So I think that's quite a big issue in Australia with retaining highly trained staff in rural areas.
Okay, so in your medical school, for example, there are about 50 students that are actually going to go through their 4 or 5 year medical program in a rural area.
So the way it works, we do, when recruiting, you can sign up through the rural entry pathway if you come from a rural location. And then in third year, which is what I'm currently doing, we spend the year, that's when we spend the year in a rural location. The rest of the time, we're pretty much based in Adelaide.
And you take your courses, which are kind of online courses, which were actually like that for the last years. Okay. And then residents, actually, you call them registrars, can go to a rural area. And I understand this is kind of a federal mandate for all of Australia. Half of the positions are funded in rural areas. So half of the registrar in general medicine, for example, are in rural areas. Is that correct? This is kind of like a law or something.
Yeah. So I think what you might be referring to is when we apply to become a medical student, there are a certain number of places that are reserved for government funding, with the expectation that at the end of your degree, you will return a certain length of time in a rural location that the government will decide needs extra bodies, essentially. So there is quite a large number of students before they've even gone through medical school who will end up working in a rural location. But again, that's only for a few years at the beginning of their career generally. And then there's no expectation that they have to remain in a rural location. So it's quite a big issue getting people to stay long term in those areas.
So even if the government has set up this program, it's still a challenge to recruit rural doctors.
It is, yeah.
Okay. So how are you involved in research as a medical student? Because we'll get to your paper soon, but how are medical students involved in research? Is it compulsory, or how is that?
Yeah, so in Australia there's two different degrees that you can do if you want to study medicine, and one of them is a 6-year undergraduate degree, and one of them is a 4-year postgraduate degree, which is the one I'm doing. And in that postgraduate course, there's actually a requirement for students to be involved in some kind of research. It doesn't specifically have to be your own project that you've come up with and you're working on and you publish. But it does mean that there's quite a clear pathway for us students to get involved in research. So this particular project is a part of that, but I decided that I wanted to try and set a project up from scratch with my supervisor. And it was quite serendipitous how it all played out, to be honest. When I was choosing a research project, because I was going to be a rural student, they had a very limited list of projects that we could jump on board with, and I thought they all sounded quite dull. So I got in contact with the topic coordinator and I said, I'm really interested in rural medicine, emergency medicine, pediatrics, listed a couple of topics and asked if there was anything, if there was a project that would relate to some of those topics. And they put me in touch with my supervisor, who is Dr. David Lim, who's from Western Sydney University. And yeah, he was looking for someone to do a project on point of care ultrasound. And he was quite happy for me to take that project in any direction which I want. So yeah, it was quite a lucky coincidence, and I was able to be fairly independent on the project, which suited me well.
So could you tell us a little bit more about how about, I don't know if Jenny, you could share that, just a picture of it for a moment, so we all get so we all see it on the screen. So we could just scroll down and see maybe this picture. Okay, yeah. So the title, if we go up to the title, okay, yeah. So it is a case, it's a commentary. It's a commentary, but it's kind of a review of the literature. It's actually a really good review of the literature on point of care ultrasound, but it also talks about emergency medicine, interfacility, rural emergency medicine, interfacility transfer problems, access to other imaging services, for example, outcomes in rural versus urban areas. And so we get to learn a lot more about this in Australia. So this is a paper just came out. And what's interesting for the students is that it will give you a good idea of what's happening, like what we're doing, what's happening in this other country. And you'll see it's quite similar, actually. Now tell us about this. Maybe we could stop sharing it now and see you on the full screen. Now, so you had this idea, and so how did this go about? Did you decide like on writing? Because the students right now, they will have to, by the end of the summer, advance on a writing project. And so we thought really interesting that you kind of get in your head because you're of the same level. How did you do this? So you had an idea, you wanted to work on ultrasound. Why ultrasound? Like, what did you know about ultrasound?
Honestly, I knew very, very little about what ultrasound was used for, which was sort of one of the reasons why I was quite interested in jumping on the project. So my supervisor sort of presented that topic as something that he wanted somebody to do a project on. And at the time I was really interested in pediatrics. And I did a little bit of reading, and one of the things that popped up was how people are using point of care ultrasound for pediatric lung conditions, which is sort of one of the biggest reasons why young kids are transferred out of their communities in Australia is for respiratory problems. And I'd never heard anything like that before, and I thought that was really interesting. And yeah, from there, the project just kind of morphed into, what it became.
So how did you start off? Did you say, well, I like that topic, you reviewed the literature? So did you have specific training on how you review literature, or you learned on did they train you on that?
Learned on the job a little bit. As I said, I have an undergraduate degree in medical sciences. And as part of that degree, we did a fair bit of searching the literature, and we did a couple of courses on, how to review literature and what kinds of things to look for to get the information that you need. So I did have a little bit of a background in that, but the rest of it was pretty much just learning on the job. And my supervisor, David, was really helpful in that, very supportive. But yeah, it was a bit of a trial and error.
Okay. How many hours? So you started thinking about this project how many years ago? And how many hours do you think you've invested? Like, what would be your work method?
So it was probably started off the project about 2 years ago, and spent about 6 months doing that initial sort of searching of the literature and forming the project. Took me quite a long time to just come up with what the final product would look like and what the actual research question was going to be. And then from there, because I'd already had quite a bit of that background research, it took me another 6 months to actually write the project. So for that half of it, it's probably taken me maybe 2 or 3 hours a week. Obviously, I'm doing this on the side of the rest of my studies, so it's been a little bit scattered, but yeah, probably a couple of hours each week.
So you would reserve some time, what, in the morning, in the evening? What would be your work method to keep up with this as you have a busy schedule?
Yeah, that was probably the biggest challenge for me, was keeping on track. And my supervisor sort of suggested that you just set aside a specific time every week just to try and progress the project. So I just found a gap in my schedule. We didn't have teaching all day, every day. And so I just had to be quite disciplined with myself and use that time to focus on the project. So yeah, I think I would spend a couple of hours each week, and that would sometimes just be, reading papers. That would sometimes just be responding to emails and doing a bit of admin for the project. But yeah, it is a real challenge, sort of keeping on track and progressing the project, because it's a long haul.
And how important was this project to you as a medical student to actually bring it through and to actually publish?
Yeah, so I was, my supervisor was actually pretty dead set on me publishing a piece right from the very beginning, which, yeah, wasn't really in my sights when I first began. But yeah, once he sort of started talking about that, it was quite exciting, and I wanted to have a final product that I could show for all the work that I'd put in. So it is important to me. I guess it's always a bit of a balance when you've got a fairly demanding degree that you're doing on the doing as well, and things outside of medicine to focus on. But yeah, I was definitely invested in finishing the project and having something to show for it.
So David Lim kind of coached you in that direction, showed the value, and then kind of kept you on the ball there.
Oh, right from the very beginning, he was clear that it was going to be that I was gonna get a published piece out of this.
Good job. How difficult was it for you to get it published? Like when you submitted, like how did you choose your journal? Did you?
Yeah, so I think one of the things that that helped me was towards the beginning of the project, when we'd sort of decided what the actual question was going to be and what it was going to look like. We looked through a couple of journals and picked the Rural and Remote Health journal right from the very beginning to aim towards publishing in that journal. And I think that was quite a helpful thing for me, because it meant I had a very clear idea of what the finished piece would look like. And you had something very concrete to aim towards, and I was able to read through similar published articles from that journal and sort of tailor my piece to fit in with other things that they publish. So I think that was something that was quite helpful for me. And then beyond that, I sort of just took a shot and I finished my piece, submitted it, and then it took them about a year. It was probably a full year for them to review and get back to me. And I kept pestering them, kept emailing, asking if they'd reviewed it yet. But yeah, once it was submitted, it was just a waiting game.
Wow, that's a long time still. Yeah,
it was a very long time.
But good for you to have it published. Congratulations again. And this just happened. So did this give you a taste for research? Would you add this to your career now, or? Yeah,
so I'm actually working on a second project at the moment in the same area, which is more of a qualitative study interviewing rural general practitioners and people who work in medicine, in emergency medicine in a rural setting to hear their opinions on ultrasound, which again was sort of always a plan right from the very beginning. But certainly having that piece finished and published, it's keeps me on track, and it makes me a lot more excited about finishing this current project, because research is a very slow process. Need something to get you excited about it.
And how do you think your level of expertise or knowledge increased in various fields? So just ultrasound, just by writing this paper, by reading all those papers.
Yeah, I mean, I think it does give you quite a unique perspective, because not a lot of people would spend their time reading the latest literature on a very specific topic. And I think this topic is quite, it has a lot of applications. Obviously, it's about medical technology. It's about rural medicine. It's about, sort of interdepartment communication. It's about third world medicine. So I think it does give you just a very different perspective on those topics, and a bit more of an appreciation for the intricacies that are involved in that, which a lot of other people probably wouldn't have. Wouldn't say I'm an expert by any means, but it definitely has added to the knowledge bank.
So how many papers did you read on ultrasound, for example?
Oh, I have no idea, to be honest. Definitely in the hundreds. Probably didn't read them all the way through, but I would have reviewed them. I would have no idea, to be honest.
Okay, so just lots of papers. And I mean, we could tell that because of the depth of this. So we worked on this as well, like ultrasound with a resident. We reviewed a bit of the literature, and we surveyed rural doctors in Quebec to see if what was their use of bedside ultrasound, of point of care ultrasound, actually. And so I thought your paper was really bringing it to another level in terms of this review of the literature. So I could tell really the depth of this, and also thinking about the future, tele-ultrasound. And so how could you actually, if you don't have any ultrasonographers, or even if you're not super certified or at ease, you can now with Reacts, the program you cited, the Panasonic Lumify, how you could do remotely assisted ultrasound, and have really make life-saving diagnoses and interventions from a distance. This is just amazing. It's just amazing also because you were probably saving helicopter trips, airplane trips, because you guys have the Royal Flying Doctors, you have all the helicopter system. It's quite impressive. I actually saw the MedStar team in Adelaide. I don't know if you've ever been there. They're kind of their hub. It's quite impressive with all the screens where they connect you with all the specialists at once. They connect the rural doctors who all have cameras in their resuscitation rooms, and then they press a button, and then the chopper is starting to roll while you're actually seeing if this patient needs to go. So there's no wait at all. If there's any hesitancy, the chopper goes. Am I exaggerating, or it's pretty much like that?
No, it's pretty much like that. I haven't specifically been involved in the MedStar team, but we've had a couple of emergency retrievals from where I'm based at the moment, and they're a very slick team.
It's a very slick team. I think I want to do that job. It's the funkiest job ever. But So MedStar, I recommend the students Google that, and the Royal Flying Doctors, just Google that. Look at what this service is all about. But in Quebec, for example, we do not have a provincial helicopter system. So we have private companies that will help out in transfers. And so we transfer patients over great distances. We do have 2 airplanes for the whole province, if my memory is correct, or if they've not updated that. And that's a good system, but it takes time. There's only 2 flights, and they'll drop one. They'll pick up several patients on the way. They could carry a few patients. And so it is not like calling an Uber, let me tell you. So it is a big issue. And I understand, for example, I know I'm making a big detour here, but I asked Australians, what would happen because it's really expensive, the helicopter system, for example, but what would happen if you take that away and say it's too expensive? What do you think Australians would say?
That would be an uproar.
Yeah, an uproar. They would go crazy because it's their safety net, getting you from, and your geography is quite honestly very similar to us. It's not the winter thing, but it is quite similar. So interesting. So we just have to go there and look at how MedStar is set up, do some stuff like that. So probably some of the innovations we'll come up with in the Living Lab or elsewhere in Quebec are really not going to be innovations. They're just going to be replication of what's been happening in Australia for a long while. But so I wanted to say, so what else do you do in life? Like what do you do in Australia? What is life in Australia for someone like you? What are your sports? How is life? What do you do?
It's pretty lovely. Adelaide's a beautiful spot. We've got about 4 different wine regions within an hour of Adelaide. We've got a beautiful coastline, and I'm originally from up in the Adelaide Hills, which is just a beautiful, beautiful spot. There's lots of forests and camping spots. So do a fair bit of that. I love to cook. We have just so much fresh food grown in SA, which is lovely. Just spend my time in trying out the wine regions, going to the beach, and playing a bit of sport. No.
Not surf. Like, are you
very, very poorly?
Are you the only medical student that does not surf? I'm kidding. We all think all Australians are surfers, but they're not, right?
All amateurs.
No, but do you surf a little bit or not? Like the young people, would they all surf pretty much?
Yeah, a little bit. I think most people, if they were staying down by the beach, they'd give it a go. I have a younger sister who is in love with surfing, and she begs me every weekend to take her down to the beach. So I do that with her a bit.
Good. So now I understand the situation is different. And we had Tim Baker actually with us, Dr. Tim Baker, who's an emergency physician. He runs the rural emergency medicine program at Deakin University, and also is in charge of all rural emergency medicine credentialing at the College of Physicians, Emergency Physicians in Australia. So he basically was telling us, I don't remember the exact time we interviewed him, it was a few months ago, that things were going really well in Australia. And one of the reasons that was before the vaccination, vaccines became widely available. And he was saying is basically because Australians actually behave quite well. Like, you tell them you're on lockdown, and that's it. And that was quite impressive. And he told us stories about, the history of prisoners and in Australia, and that, probably he was joking, but probably you do what you're told. And we have public health experts here. And that's been a really big challenge, actually, in the province of Quebec. But we actually, so far, so good. The vaccine, we have 60% of our eligible population that is fully vaccinated, 2 doses. And so, but I understand right now things are changing in Australia. I'm sorry to hear. So what is the situation right now in your neck of the woods?
So where I am in Adelaide, we've just done a 7-day snap lockdown, which we've done a few of over the last 18 months. But it was a very, very rapid decision because we had a couple of cases of the Delta strain of the COVID-19 pop up in South Australia. So far, we've been really, really lucky in SA. We've had very, very few cases. The state government's been really wonderful at imposing very strict lockdown measures and strict border control as soon as COVID starts popping up. So I think we've been really well protected so far. New South Wales and Victoria have not been so lucky. They've been in and out of lockdowns for a very long time. And I think just their population density just makes it so much harder to control, whereas Adelaide's a lot more spread out. So, I think that's had quite a big impact. But on the whole, Australia's been doing doing really well.
So, but actually what happens is that for those of you who don't know this, so just a few cases will lead to a full lockdown. That means you cannot give us an idea of what a lockdown is in Australia, because I didn't hear it all.
So it means that you're not allowed to leave your house except for very select reasons. So you can go food shopping, you can go to the doctor. If you're an essential worker, so that's people in the health industry, people who are doing food production, if you work in a chemist, that kind of thing is essential, but everything else shuts down. And you're not allowed to visit other people unless they live entirely alone and you're visiting one specific person. And you can only go about 2 kilometers from your house to do some outside exercise. But beyond that, it's pretty much you stay at home. You don't leave the house unless you have to. And only one person can go to the shops at a time from each household. So I think it is quite restrictive, and it's, it seems quite severe when we only have 1 or 2 cases in South Australia, but it really does mean that they can get on top of the contact tracing. So anyone who's been in contact or in a location where someone with COVID has visited, they'll trace you back and ask you to be tested.
So Annie, so people are not people respond well to this, like those measures, because here it's like an uproar when that happens. Really, people. I don't imagine how we could lock down as severely as that for such a while. So I think. So do you think people your age, like your friends, they think that's a reasonable price to pay to be off the hook or in a certain way? It's short-term pain for long-term gain.
Yeah, I think in South Australia, everyone's been very, very compliant and very understanding with that. People my age as well, from what I've seen on social media and that kind of thing, they're very, very understanding and very on board with those restrictions, because I guess we've seen what's happening in the United Kingdom and other parts of the world that are not weren't able to control the virus quite as well. We have had quite a few people protesting actually last week when we had this snap lockdown in New South Wales and Victoria. People who are just not understanding why such strict measures are being put in place when there's relatively good control of the virus. But on the whole, I think particularly the younger generation, they're very understanding and very compliant.
So very interesting. How is it with the vaccination? How are you? Are you vaccinated?
I am vaccinated. It's been a bit of a disaster in Australia, to be honest. I think initially when the vaccine started coming out, the Australian government only really signed up to get the AstraZeneca vaccination. And then when the issues were popping up with people getting blood clots from that vaccine, the media ran away with that a little bit. And there was very poor communication, in my opinion, from the government in terms of who was eligible. They kept changing the age range for who was eligible to get that AstraZeneca vaccination. And we then got a big shipment of the Pfizer vaccine, but at that point, everyone was a little bit hesitant to go out and get vaccinated. I think at this point, they've been doing the vaccination program in waves. So all healthcare workers, aged care workers, people with chronic diseases were all in the first wave. And I believe that the large majority of those people in that first category have been vaccinated. But it hit a bit of a snare when it was opened up to just the general public and people in rural areas. It was just very difficult to access. I think last time I checked, there was about a 4-month wait for an appointment to get your vaccination. and people who are quite keen to get vaccinated are not always able to access that.
So here we have a rich country that was cutting edge really in the management of the pandemic, in a situation where there was kind of oversight vis-a-vis the management of the vaccination process.
Yeah, absolutely.
That could actually be fatal for your president or premier or whatever. I understand it's a big political thing right now.
Yeah, I think everyone's very upset with how the vaccination program was managed. So quite significant.
Yeah, that's to keep an eye on that. So how many people are what's the proportion of everybody fully vaccinated in Australia right now, you would say?
I haven't actually checked the recent statistics, but it's nowhere near as much as you guys. Yeah, probably around that, probably even less than that, I would guess. Nowhere near 50%.
Yeah.
Yeah, I think we're doing quite poorly in that respect.
Wow. So Annie, I'm going to stop there with my questions, and perhaps maybe we have a special guest, our public health, since we ended up talking about COVID. Perhaps Dr. Girard, who really sits down with all of the leaders in public health across Quebec and Canada. He's been part of our Living Lab, and we've worked with him with the Living Lab to manage a rural pandemic, actually. But Dr. Girard has always been open to all of this. And so I'm going to give him the first question here today, Dr. Girard. And then what we'll do is different, is our students probably have lots of questions on your article and everything. But what I'd like to do is I'd like to actually give you the chance, Annie, to ask questions to the students if you want. So what do you imagine about medicine in Quebec and Canada? And but now, Dr. Girard, bonjour Jacques, ça va bien?
Yes, I'm so fine. You? What about you?
Very good. Thank you for being here. Now, Dr. Girard, do you have a question for our medical student from Australia?
Yes, probably I would have two questions. The first one, I can't stay with the COVID-19, but there's another one regarding the universities network in Australia that I'm aware of in terms of I would say their assets in terms of training physicians in a way that they would respond even better than other countries to specific social needs. So I would keep this question for as a second step. But my first step would be regarding the pandemics in general. There are three factors that we're looking at this very moment regarding how the pandemics will be evolving in the coming months or in the coming year, in a way, because it's not even terminated. Of course, it's just popping up everywhere at this very moment, especially with some variants that are more aggressive than others. And there are plenty of them that keep us very busy in terms of surveillance and other aspect. I was wondering, because Australia, as you mentioned, has a low vaccination rate. It's one of the, I would say, main factor that seems to be working in terms of impeding the virus to extend in our communities and generate complications at the intensive unit. We know that, for instance, there are twice the number of patients going to the intensive care with this variant, with the variant Delta, and even 3 times more deaths. So this virus, for the people who are unvaccinated, is very, very troublesome for a lot of us. We're thinking more of what's going on in the United States, because this is our closest neighbor, and they're not doing very well with vaccination. But even Australia has I think you're the share of people fully vaccinated from the data that I have in front of me. It says that 13%, which is of course very low. And you just explained why it was so. I think there were some hesitations for launching the campaign as such. And the other aspect is strict measures. I think that Australia was a good example of an elimination strategy with New Zealand, for instance, and other countries in Asia in general. But Australia was a very, very good example for us in terms of the efficacy of those strict measures. So this is the second factor. And the third one is travel. I would like that you just explain to us a little bit more about travels in general, because we know that you set up a specific agreement with New Zealand, for instance, in terms of traveling from a country to another. But and you were asking travelers to be on quarantine in the hotel for 2 weeks. You were very strict on those measures. Is it still going on, this aspect? Because of course, this is the third factor, opening the boundaries. This is something that we look at very carefully. At this very moment, we have a lot of pressure to open the boundaries to United States, to Europe, to elsewhere in the world, but taking into account the variant, we're very concerned. So that would be my first question, Annie. The traveling, the way the government, the way you as Australians are trying to figure out what could happen in Australia for the coming months in terms of opening up boundaries. And the second question would be for the university network. I know that with James Cook University in Queensland, Flinders is very active in specific research projects for having actually the manpower at the good place. So I was wondering, from your perspective as a medical student, do you feel that what is the value added having people as you being involved in remote or rural areas for your training, but also for your training in terms of the way you could deal with specific health problems? I would ask you this question because the value added for us in Quebec, especially, we feel that it's probably something important because right now our 4 universities where we have a faculty of medicine have decided to set up a campus outside the urban area. Outside Montreal, outside Quebec City, outside Sherbrooke, even if Sherbrooke is not a so big town. And it sounds that this is something these days that would provide us new physicians that will probably be very interacting better with the population. Well, this is our experience from the students who accepted to go on electives in remote areas, but now it will be like a specific track to go there for not just a month or 2, but for the whole year, well, even 2 years. So, and even 5 years actually, because we will have campus outside Quebec City in this for Laval University. So I was wondering the value added. So these are my 2 questions. First, traveling in Australia, what is the perspective? And secondly, what in your view, the value added to have this training in remote and rural areas in Australia?
Yeah, so I'll answer your first question first. For us, our travel has been very, very restricted. And that's sort of determined by each individual state government. So some states are a little bit more lenient with who they'll allow in and out of the state, and others are very, very strict. So most, at the moment, now that we have a fair few cases in New South Wales and Victoria, most of the state borders have been relatively strictly closed. And if you do want to travel interstate, even interstate, you need to do that 2-week quarantine. And typically you need to get tested on the day that you come back in, on day 3, on day 7, and then on day 13. And if you have sort of negative tests all the way through, then you're allowed to just move around freely. And then in terms of traveling to New Zealand, we did for a time have an open borders, a bit of a travel bubble, they were calling it. Mm-hmm. Where if you were coming from a state that had no cases of COVID, I believe you still needed to quarantine, but it was a much shorter time, and you only needed to get tested sort of on arrival. I think now that we've got a few more cases, that bubble has now closed. They'll probably be looking at opening that back up once we get the situation under a bit better control. I think that does make quite a big difference to the spread of the virus. Obviously, you know exactly who's coming from which area. You can do the contact tracing a lot more efficiently if you've got people remaining in one place for 2 weeks. So yeah, I think that was quite a good decision, particularly because our different states are set up so differently. Like in Adelaide, we have we're very widely spread. Our public transport network is not particularly good, so not many people use it. Whereas in Sydney and Melbourne, they're a lot more densely populated. They have people travelling on the public transport, and they're much more densely packed. So I think it was quite a good measure to keep the states quite separate, so that we were able to better control the virus. And in terms of your second question about the value of studying rurally, I think there's a huge value in it. I think rural practitioners in Australia particularly have just a very different way of viewing medicine. I think it's a bit more of a holistic approach, because if you are in a resource limited setting, a lot of those general practitioners will have several different additional specialties that they are well versed in. And I think that's quite a big difference to working in the city, where you can very easily send people off to a specialist. If you're sending someone from a rural community, they might need to travel for several hours to access those services. So I think you do get a bit of a perspective from that side of things when you are studying rurally, and a bit of more of an appreciation for that holistic side of things of trying to provide as much care in the community as you possibly can. So yeah, that's what I would say is the biggest value.
Thank you so much for your response. Actually, some of our young physicians are telling us that the fact that they were trained in a rural setting, they feel more confident dealing with problems. And it's interesting. I think that it's not a question only of competencies as such, but the way that they feel secure to take decisions, to really be close to the patient, to their families, to the communities also, because there are more opportunities when you are practicing in a rural setting. You come to know a lot of people, and when you go shopping, when you go elsewhere, everybody just recognizes you. You're not just the physician of the place, but you are part of you are a citizen as they are, and this makes a huge difference in terms of interacting. So please, I'm very pleased to hear from you with these. I think that the overall perspective you get is somewhat an asset that makes medicine more human, as you say it, and so I'm pleased to hear that.
So Annie, wow, you got a got some interesting question and lots of background from a leading public health physician in Canada, actually. And it's very interesting, Jacques. Thank you very much for those questions and the background. Now, Jacques, I don't want to scare Annie whatsoever, but if from your perspective, you're someone who follows the literature internationally. You sit on many committees. Are you concerned right now for the health and well-being of Australia at this point, knowing the low vaccination rate, Jacques?
No, I think that you say, as I mentioned, there are two factors that they are managing very well. So the measures, what we call the non-pharmacological measures, the strict measures, the public health measures, and I would say the travel, the boundaries. Well, it's not just the fact that it's an island; it's a continent in a way. So it's just that I think that they did very well, and so far we are all recognizing that it was the way to do. But I think that the vaccination, as from the moment you get the vaccines, I think that I'm pretty sure that Australians would catch up very easily in the coming months. I'm not so concerned about that. I'm a little bit more concerned for other countries than Australia, to tell you the truth, and especially in the region, well, the Southeast region, for instance, or African region, where vaccination is not even 2%. So it's just frightening for all of us to think that as far as the virus will be circulating, we will be assisting to new variants. And well, we hope that we won't have to deal with a new variant that would have to have us starting again with new vaccines, because the variant that could defy immunity that provided by the vaccines is something that we are very concerned. I think that the challenge is really it's a planetary challenge, I would say. But Australia, for me, it's not. I'm not concerned at all. We have a colleague there, Jean-Frédéric, who is that you know pretty well. That he provides us a lot of clues for what's going on in Australia. So we're pretty lucky to have him there. He adopted your country, Annie. He doesn't want to come back. But I know he is doing a good job in terms of public health. So I'm not concerned about that. But I think that the thing it would be to make sure that all countries, especially surrounding Australia, would have the possibility of having the protection provided by the vaccines, because they are very, very effective. So we have this, but the problem is that we will have to face probably something like a coverage would be like more closer to 82% than 75%. So which means that we will have to catch up quickly in North America and Europe, Latin America, Africa. So it's a huge challenge. We will have probably for 1 year more dealing with this issue regarding vaccination, and hopefully we won't have to face a new variant that would have change everything.
I think one of the reasons why the Australian public have not been sort of seeking out vaccines as much as they should have been is because we've controlled it so well and we've had so few cases that it doesn't feel like so much of a threat to us. But yeah, looking at what's happening in surrounding countries, it's pretty frightening. So hopefully we'll catch up.
So once again, thank you, Jacques. What I'd like to do now is something a little bit different. What I'm going to ask you, Annie, is just pick someone on the screen, just name them, and ask them a question on what you think about anything in Canada, any question. Just name them, and then they ask you their question thereafter, because most of them prepared questions. So how is that? So I'm putting you on the spot, but this is how they're put on the spot all the time. So any questions you have about anything, the Living Lab, rural medicine in Quebec, their medical training, or even those who are not in medicine doing research, anything you want, you can ask them, and I'll ask that this keeps the spirit of rapid fire. So, we ask a short answer, it's humoristic. So how about pick someone there, Annie?
Sorry, so the first on my list is Steffi.
Steffi.
Is that one of the students? Yeah.
Sure. So
Hi, Annie.
Hello, nice to meet
Steffi's
you.
a graduate student. So yeah, go ahead with your question, Annie. She's a graduate student in public health, actually.
Epidemiology.
Epidemiology, sorry.
Yeah, so how are you finding it? Are you involved in researching the COVID-19 outbreak, or
So
from a
actually-
public health perspective?
Yes, actually, so I'm on the process of conducting my thesis. So it's going to be on the psychosocial aspect of the COVID-19 and rural population in Quebec. So it's very exciting, and I'm currently working on my methodology and also to publish something by the end of the summer.
Oh, congratulations.
Thank you. So I just want to thank you for your perspective. It was very interesting, and I really like your article. I actually I was wondering, so since, how did you come about to choose the best methodology that will fit your research question? I found this is a challenge that I have, like, what is the tool? Do you have an advice for that? And my other question was that, do you have, what was the response and the field of your since your publication?
Yeah, so in terms of picking the methodology, I think really that I didn't use any specific tools. I pretty much just looked at, what question I was looking to answer. And the piece that I published is actually a sort of a precursor to what I'm working on at the moment. It set the stage, and it I guess provided a little bit of background to what I'm working on at the moment. And because that one was just a commentary, a literature review, I basically just worked out what I wanted to look into, and then decided that because there wasn't a huge amount of literature published on the topic, that a bit more of an opinion piece or a commentary would suit what I wanted to do a little bit more than a literature review per se. And then again with the second half of the project, which is it's more of a qualitative study. Again, because there's not much literature on the topic, I decided that I'd need to be collecting some data myself, and I thought the best way to do that would be to interview people to get that that qualitative data. So it really for me just came down to what question I wanted to answer and the best way to do that. So not particularly helpful there, I'm sorry.
Okay.
I think you're extremely helpful. And what you just said, Annie, is what we've been talking in the writing school, the summer school, is basically if you know the opportunity in the literature, if you know the gap in the literature, and it's even, you can fill it quite easily. If you're the first on the moon, you just put a flag, you don't build a skyscraper. Okay, so you don't need to do that. You just need to but that is a talent. It's an art, it's a vision to be able to find that gap in the literature, find the correct journal and just fill the gap. And I suspected you were working on something bigger. By the way, if you are interested in having a Canadian arm to your Quebec arm to your study, qualitative, maybe eventually some of the students could actually, translate your questionnaires and conduct interviews in rural in here if you want.
Yeah, absolutely.
So that would be fun as well. So, but a good question, Steffi. How about you pick someone else?
So next, I'm just going down the grid. I'm not picking. Next up is Emily.
So Emily is with Diane. So there are two medical students, and they're in the hospital in Charlevoix in Baie-Saint-Paul, I think today.
We're there for the reflexive workshop with the nurses.
Yeah, so yeah.
I want to apologize for just being a little late. We were in the middle of an interview, so we caught the last part of it. So.
So they're doing funky stuff right there with the two guys you see together. So they're interviewing nurses using design thinking principles. They're interviewing them to see, how could we recruit nurses? How could we retain them? And they made it's a qualitative kind of study. And then they're going to find solutions and bring them to the decision makers. Yeah, it's kind of a funky, but I'll ask you. How about you ask your whatever question you want, then?
Yeah, I'm not sure if this is what you guys are working on, but Rick was saying before we began that there's a big shortage of nurses in rural Quebec. I guess what drives that? Because we have a shortage of doctors, and I'm just wondering if it's similar factors.
Okay, yeah, I can try to explain. I think you're asking why do we have a nurses shortage? Is that? Yeah, it's really a complex issue because we've learned recently that, in fact, in Quebec, the number of nurses we officially have, it really isn't that low. It's just the dispersion of the nurses, and then because of the working conditions and all, they choose to go into agencies or to work only part-time, because with the mandatory overtime, yeah, they're getting in a situation where if they work part-time, they're gonna have a full-time job. So if they work full-time, they're gonna have really too much job.
Yeah, so basically the workload is such that because there's mandatory overtime, they don't necessarily get paid. But if you're coming from an agency, they get paid time and a half, or they get paid more, or stuff like that. But yeah, essentially there's a problem of distribution where the nurses can go. There's an exodus of nurses to the agencies. Agencies are private entities. And we have a public-private system. So it's mostly public, but we also have some private, I guess, businesses as well that are attached to it.
So it's really a complex issue because there are a lot of factors to take in account. So there's the working conditions that aren't that good. So that makes that the profession isn't seen like it's something that the young people want to go to study, because it doesn't make the job attractive at all. So, and then there's all that. It's really complex. We're trying to understand it at the moment, and every nurse that we talk with, they bring other points that we didn't know before. So it's really interesting to work on that. Sorry about English. It's not
No, it's perfect.
Actually, quite impressed with your English, Emily. Very good.
Thanks.
Diane is perfectly English. She's trained in McGill.
I'm Anglophone.
She's Anglophone. So, So, how about Emily and Diane? Do you guys have a question for Annie on anything?
Yeah. Well, I can start maybe. So read your article, and it's really interesting actually. And I was wondering, so we have ultrasound, or we're starting to, at least at Laval, and I think even in other universities, incorporate ultrasound training like within the actual medical school. So we're using the devices in the context of our program, before residency and all these things. And I'm wondering if this is something that you guys are doing in Australia, if you guys are incorporating the ultrasound, the tools and all that stuff within your medical schools, or is this something that's not discussed yet?
Yeah, so certainly my medical school, we are not at all. And from what I've been researching, no other universities are really incorporating it in a very substantial way at all. So we talk about it from an obstetric point of view. And obviously we learn about echocardiograms. We learn a little bit about doing abdominal ultrasounds for trauma. But beyond that, it's not really talked about at all, which I thought was quite unusual. And yeah, that's sort of one of the big factors that I believe sort of play into people graduating and not having an understanding of what ultrasound could be used for. Because we do have access. Most emergency departments in rural Australia have a machine, a bedside ultrasound that can be wheeled around. It's just not very used very often at all.
Mm-hmm.
Yeah,
that would certainly help the buy-in from.
Yeah, I think so.
Yeah. I don't know. Thank you so.
Did you have a question?
Yeah, I was wondering, because I'm working on the React project at the same time on the side about the telemedicine in the ambulances, and I was wondering, what do you think about the Lumify technology with the React?
Yeah, I think it's pretty amazing. It's such a good idea. For us, we've got quite a big issue with quality assurance for people who want to use ultrasound, because we don't have very clear guidelines on how much training you need to become proficient in using point of care ultrasound. I think those telehealth advances can really help people feel more confident in their skills. Because from the GPs that I've been speaking to, a lot of them would be interested in using ultrasound, and they think it would be valuable, but they don't have any confidence in their skills, and so they wouldn't feel confident making clinical judgments in terms of patient care based on the images that they're producing. So I think those kinds of telehealth, like the Lumify, and there's a few others out there, I think they can really help physicians feel a bit more confident in making decisions based on the images that they're producing. So I think in Australia, that's probably the biggest application for those technologies that I could see.
Okay, so it's really for the boosting the clinicians' confidence and like for teaching and yeah. Okay.
Yeah.
Yeah, and our ambulances, our paramedics actually want to use it in the ambulance for certifying death, for example, instead of transporting. There are multiple ways to certify, but if they can show that there's no cardiac activity, that's another way to certify.
Wow. Yeah.
Or they could, do pneumothorax, attention pneumothorax, and they put their basic life support paramedics. There are only 30 advanced life support paramedics in the province of Quebec, so different than in Australia. So excellent question, and so I'll let you choose somebody else.
I have another question, actually, if that's okay. It's just
absolutely.
So is the Australian program all public, or is there also public-private entities?
For medical school?
Or no, like for your medical system in general?
So there's a mixture of both. Mostly starting from medical school, most of them are public. there are a few private universities. I think there's maybe 3 or 4 that you can basically pay to attend. And then in terms of our medical system, we have both. Most of the big centres are public, and then they might have sort of an offset of a private system. Yeah, so there's a real mixture.
Okay, thank you. Sorry, I didn't want.
Thank you. How about the next one?
Next on my list is Emeric.
Hi, Annie.
Hello.
Do you have a question for me?
Yeah, whereabouts are you guys? It looks beautiful.
Yeah. So we're in La Malbaie. So it's the next big city. It's the next rural city after Baie-Saint-Paul and Charlevoix, where the living lab is taking place. We were also at the hospital today. We were conducting the same type of interviews. So to compare then both hospitals in the same region, but it's two different hospitals, 2 different mentalities, and so it's interesting to look at that.
So you know, and Annie, Charlevoix region is the most popular tourist area in all the province of Quebec this summer. It's always popular, but this summer surveys have shown that, so the population, about 50,000 normally all around, with the small cities, 40,000. And now it's increasing up to 100,000 during the summer months. So it's a really nice. That's where the Cirque du Soleil was founded, in the Charlevoix area. It's a very art town. Lots of art galleries, lots of good restaurants. It's on the St. Lawrence River, and among the big ski hills as well in that area on the eastern coast. So yeah,
Beautiful.
Yeah, and so with the summer right now, one nurse told us this morning that about 60% of the patients that get into the hospital are tourists. So it's different for the nurses and the doctors who are used to seeing always, the same type of people. Some people from the region. Right now, it's I don't know, younger bikers or different type of patients. I have a question for you. It's a very broad question concerning regarding your paper you published, and I just wanted to know, as a medical student, what's the biggest thing you learned by writing that, and how is that going to help you in your future practice as a physician? Because I don't know what's it like in Australia, but here most physicians, most med students, they don't really publish papers until they get to residency or as a doctor. So I want to hear what you learned.
Yeah, good question. I think probably the biggest thing would be, for me, just to not be put off by something that you're sort of overwhelmed by. I think research takes a lot of work, and it feels like this really big unachievable goal. But I guess the biggest thing I learned was that you just need to be quite disciplined with yourself and just chip away at it slowly. And I think that sort of plays into medicine as well. It's often seen as this big imposing career that you need to be sort of on top of your game for. And it definitely is challenging, but I think it definitely is a good lesson to learn, that you can sort of achieve things just by slowly chipping away at them. Just not to be intimidated by something that scares you a little bit.
Yeah, thank you. So it's intimidating, and as you said, getting started as a physician is also intimidating, and having this kind of experience before, you're maybe more ready to become a physician. I would guess. Yeah, thank you for your answer.
No worries.
This is actually working out quite well, actually. This is quite interesting. So you would probably have Nicolas that's right next to him. Nicolas is also a medical student, and they're pairing, and they're all staying. The four of them are staying in an Airbnb together in Charlevoix overnight for the next couple of nights, I think. And yeah, do you have a question for Nicolas? Anything?
I guess I'm really interested to hear just from everyone what kind of things you're working on and how you got involved in being a part of the Living Lab, because it sounds like a really interesting interesting setup. So, you know, anyone can answer that question.
Well, maybe I'll let Nicolas, because he actually did. Nicolas, perhaps you could tell the story. But Nicolas actually called me one day. He wanted to be a research assistant with us, like a student, like on a student project. And I said, well, we have this Living Lab project. How about we have this leadership and innovation rotation going on with other healthcare professionals. And if you want to sit in and see what's happening. And he actually stayed for 2 months. So he participated in every activity for 2 months. And now he's joining his fellow medical students. He's actually recruited some of them. We have 5 right now. So he has a key role actually in this rotation. So interesting. Yeah. And Nika, do you want to talk about what you're doing? What's in the Living Lab?
Yeah, so as Richard said, so I'm a big tech guy, and before medicine, I was a big tech guy. And when I first talked to Rick Fleet, so my first impression was that he was working on some really technological, cool projects in a rural setting. So that's really what drew me into the Living Lab at first. And right now we're working, as Emily and Diane talked a little bit before, we're working with Reacts and how we can implement Reacts. So Reacts is pretty much a video teleconference application that nurses can use during an ambulance transfer from one hospital to another. And so that's one of the projects we are working on, and we're also working on the what we call the Atelier Réflectif, which is pretty much a talking kind of activity with the nurses of the region, and we talk about the nurse shortage and what their problems are and what the solution they think that a good solution would be. And so yeah, that's what we're working on. And I just want to say congratulations for your article, and it's very good.
Oh, thank you.
And my question for you is that, well, from what I can hear, it seems that you took the writing of your article from a very creative perspective. And I'm just wondering if, like, you have any creative backgrounds that help you with writing your first article, or how you went about it?
I don't really. When I was in high school, I did in Australia we have a few different ways you can get that high school qualification, and I personally did the International Baccalaureate, which you may have in Canada as well. I'm not entirely sure, but that had quite a heavy focus on writing really big pieces of work. So it's not, you know, a small assignment every couple of weeks. It's sort of one big thesis that you write throughout the whole year. So I did have a bit of a background in that, which I think probably did help a little bit for setting up the structure of a large piece of work and working through it slowly. Beyond that, in my undergraduate degree, we did some literature reviews, which have quite a similar structure to what I was working on. So nothing formal, just little bits and pieces here and there, which I'm sure have all helped. But yeah, no formal background.
Okay, well, I'm just wondering, like, how well. I think that it was Steffi who asked you the question about your work methodology. Like, how did you come up with something that, like, made it all work?
Yeah, so I mostly was just workshopping that with my supervisor. And as I said, it took me 6 months of just sort of reading the literature and seeing what was out there, and deciding which direction I wanted to take the project. So it definitely wasn't just a quick decision. This is what I'm going to focus on. This is what I'd like to write. It took quite a long time just workshopping to figure out what direction to go in. And I think once I had a clear idea of what I wanted to look into, my supervisor and I sat down and almost wrote the outline, the plan of the project there and then. And once we'd done that, we sort of then knew how to go about writing it, if that makes sense. So I think having quite a clear plan of what it will look like as a finished product really helped me. Just makes it feel a little bit more achievable, and you know what to aim for. Does that answer your question?
Yeah, that's perfect. Thank you very much for your response.
No worries.
Okay, so about you go down. So we have a few graduate. So maybe I'll pick on them as we go. As time flies, maybe now I'll go to another graduate student of ours, Julie Théberge, and perhaps Julie, I'd like you to tell briefly, give Annie an overview of what you're doing, because all of the students took part actually in your study as subjects. So what is your PhD study?
Hi, Annie. How are you?
I'm good, thank you. How are you?
I'm good. First of all, thank you for taking the time this early in the morning for you. It's nice to see that there's a tomorrow. It's encouraging for us. Anyway, for me. Richard talked a bit about my research. It's a custom design PhD mixing arts and medicine. So I have two directors. Richard is one of the directors, and the other is Jocelyn Robert. He's an artist, visual artist, because my background is mostly in visual arts, and I've worked for many years in a social circus program using circus as an intervention tool. So this PhD is kind of a mixture of all these interests, and making a circus show on one of Richard's rural research. So we did the show. The show is done. I've done the data collection, and as Richard mentioned, everybody participated. Thank you so very much. I'm starting to read your questionnaires, and it's very interesting. So here I am. I have no research experience, so this is all as I go, and doing the creation of the show was a bit more of a known place for me, because doing shows I've already done, but doing the analysis and the writing is for me now very new.
That sounds fascinating.
Yeah.
And I tell you what we're going to do is we have actually a 3-minute clip of that. And Julie, could you play that?
I think I can. Can I do that? Yes. Partager l'écran.
No one actually saw the teaser of the show, because we may go on. So it's the whole show is taped, but it's all in French. But you're going to get a little bit of an idea.
Do you see my desktop? Yes.
Yeah.
Okay. It's a bit of a mess. Here you go.
I think there should be something with the sound though, but can you do something with this, because we don't hear it?
Pour partir le son, Julie, faut recommencer ton partage d'écran, puis il faut aller dans Advance à ta droite quand tu ouvres le partage d'écran, puis tu coches son de l'ordinateur.
Uniquement le son de l'ordinateur. OK. Puis après ça, je vais de base, puis je partage l'écran. Partager l'écran. Puis on recommence. Vous me direz si ça fonctionne.
Non.
Tu Tu peux essayer autre chose aussi. Je pense que dans ce cas-ci, tu pouvais juste, quand tu ouvres ton partage d'écran, sans aller dans Advanced, Share Computer Sound.
Ah oui, je peux-tu faire ça?
Je pense que juste ça aurait marché.
QuickTime Player. Mettre en attente, blablabla. Partager l'audio. Est-ce que je peux partager l'audio?
Oui.
Partager l'écran. OK, on recommence. Here we go again. Ça marche-tu?
Yeah.
Ah! Il n'y a rien qui marche. It's not working.
No, it was working.
Oh, it was. Okay, I thought you said no.
It was.
Okay, here we go again.
Ça prend en moyenne 17 ans pour que 14% des recherches aient un impact dans nos vies, pour qu'on puisse appliquer les résultats de la recherche à notre système de 17 ans! 14%! Hey, ça, c'est de l'argent pitché en l'air, pas pire, hein? Je sais pas, là, mais... Moi, je sais pas, là, mais... Moi, toutes ces expériences-là qu'on fait, là, qui concernent tout le monde, il faut que ça soit aux nouvelles du soir. Il faut que ça sorte partout. D'ailleurs, vous savez quoi? Moi, je pense que toutes les recherches devraient avoir leur œuvre dédiée, œuvre artistique, comme ça, là, hein? Enfin, l'art pourrait servir à quelque chose.
Attends un peu, quoi?
Non, mais c'est vrai, là, on va arrêter de nous tarder de pelleter de nuages, là. Faisons de la science, nous aussi.
Bon. Bonne affaire de fête. Est-ce qu'il n'y a pas de... Quoi? Qu'est-ce qu'il y a?
C'était une joke.
Ah, une joke.
Ah,
okay,
joke.
Ouais. Ah, mais là, ça change tout. Ça change tout, ouais, c'est ça. Ouais, vas-y donc. Bon.
M'excuse, j'ai pété une fuse, mais ça m'arrive des fois.
Bon, parfait. Maintenant, t'as-tu fini de niaiser? Oui. On ramasse.
So this is an hour show compared to a web conference, compared to a research report. And basically we did this because it's hard to get the attention of people, decision makers, and anybody to actually bring better services in rural areas. So we'll be sure to one day maybe talk about your study and bedside ultrasound. And in fact, there is a little scene where they talk about ultrasound in this study. So the trouble you have to go through to actually mobilize people. Tom is flying, so Julie, maybe we'll, I don't know if you had a question or for...
No, it's just a comment. I really enjoyed reading your articles, and congratulations. I mean, it's I've seen you've submitted it in July 2021 and it got published a year later. So, it's a lot of work before and it's still a lot of work after. And I have, a lot of questions, but yeah, time flies. So we'll just keep on going, but we'll talk again later.
Thank you very much.
Good job.
That's fantastic. So how about Cody? So Cody is also a medical student, third-year medical student. And do you have a question for Cody, Annie? So when you look at him, like, what do you think? What is he thinking? What is he thinking, this guy?
Looks pretty chilled out, to be honest.
Pretty relaxed. Yeah. Is he more arts? Is he more science? Is he more, what is this guy about?
Looks like a surfer.
He looks like a surfer. Yeah. Yeah. Cody's actually an actor. He's actually into acting, but he's also a medical student. So what is your question for Cody?
Yeah, I guess nothing specific. I guess just how are you finding medicine? I don't know a huge amount about the program in Canada.
I actually really like my program, and I wouldn't see myself studying any other subject right now. I hesitated a lot between medicine for animals, like médecine vétérinaire in French. I don't really know how to say it in English.
I think it's
vet school. Oh, okay. So yeah, I hesitated a lot about between this and medical school, and now I'm pretty happy with the choice I made and the experience I get to live being a med student right now, and like considering the things we do this summer, this is actually crazy and really cool to have the chance to live these kind of experience at such a young age and such an early stage in my study and in my professional career. So yeah, I'm pretty satisfied of the chances I get to live, and I found it really interesting to meet you, and I'm really glad we had to. We spoke about the system in Australia and all, because I actually have family in Australia, living in Australia. Like my sister's living in Melbourne, and I have an aunt who's in Perth and a cousin who's actually willing to get into med school in Australia. So I found it cool to learn a bit more about this. And my question for you would be, considering med students have the opportunity to study in urban centers and rural centers, I suspect there must be doctors who have been trained in urban centers who practice in rural settings. And do you see what are the differences? Can you identify differences, or can you identify doctors who have been trained in urban settings versus rural settings? Do you see some differences in the way they practice, or are doctors trained in urban settings? Are they trained sufficiently to practice in rural settings? So I asked you a lot of questions, but
It's all right. I'll do my best. So in Australia, pretty much, I would think every single medical school actually has a compulsory rural placement. Usually it's for sort of 5 to 10 weeks, unless you sign up for a rural program where it's a lot longer. So I think pretty much it's such a huge focus in Australia that pretty much every single doctor graduating would have some experience in a rural setting. But that being said, it's very variable, your experience, depending on where you are. So I currently am, it's very close to Adelaide, and it feels quite, it doesn't feel particularly rural because we are so close, whereas some people are hours out of a major centre. And so I do think you get quite a different experience depending on where you're located. I guess in terms of whether or not you can tell if someone's been trained rurally, I think, as I said before, I think you just get quite a different perspective on what services a doctor should be able to provide to their community. I think people trained rurally have a bit more of an appreciation for, I guess, trying to do as much for that patient as they can. You know, that sort of that continuity of care of seeing a patient and seeing them through all the way to the resolution of whatever problem they came in with. My perspective is that's quite a big difference in rural medicine in Australia, just because we don't have access to a lot of specialist care outside of the urban centres.
Thank you. I think we've some have had to leave. I think we pretty much asked everybody. Have you interact with most people, and you're probably having trouble now holding your bladder at this point. We all could log off at one point, but you're being there, so we don't want to keep you too long. Again, Annie. Now, Jenny, are you Jenny? I don't know if you're still there. Are you proud of the students? Perhaps she had to go as well. So the students, first of all, you're yeah. And how did you find this experience, Jenny, the interaction with our medical students with Annie? Oh, you're muted.
Very interesting. I think we could have spent another hour talking about that, because we didn't talk about the REACT project really. And so, yeah, it was really, really nice to participate to this meeting.
Yeah, absolutely. So what we're going to do now, Annie, is we're going to ask you what we do often when we debrief at the end of a day. It's a reflective rotation in the leadership and innovation. So there's lots of self-reflecting on one's leadership or one's perspective on things in life in general. So I'd like you to, in a rapid fire way, can you share with us how you feel right now after this experience? And can you share with us one thing you have learned? So how do you feel? Or one thing you've learned? So they're always asked this question. So what did you learn, perhaps?
Definitely learned a lot more about what you guys are up to. It sounds like there's some really fascinating projects going on in the sphere of medicine and public health and epidemiology. So yeah, definitely didn't know very much about what you guys were working on. So that was really interesting for me. And I feel wonderful at the moment. I was pretty not nervous coming in, but definitely did not feel qualified to be interviewed by a bunch of students. So it feels good having met all of you guys, and hopefully I did all right.
Yeah, so they'll let you now know how you did. So one word to describe your experience, Julie.
Stimulating.
Jenny. Jenny, you're muted. How about we go with Cody?
I'd say traveling without moving.
Traveling without moving. We got the impression we were in Australia. How about Diane?
Intriguing.
Intriguing. So you were intrigued by all of this.
Yeah,
How about Emily?
I want to learn more.
I found it was really informative. It was really interesting to learn about the experience of a medical student in another country.
All right, Steffi.
Me, it's curiosity.
Curious.
Mm-hmm.
You're curious. Nicolas.
So I'd say inspiring and motivating, because it's nice to see that you were where we are now a couple months ago. And it's really inspiring for us.
Yeah, she's an international star now. Third year medical student, international star. And Emmerich.
Yeah, I'd go with motivating too, because I can see what a med student can do and have an impact on the research world as a med student. It's very motivating.
It's also for our master's and PhD students who have not really published yet. So it's to get them inspired that, you can publish your first paper. And so good. By the way, Nicolas and Emmerich are both skiers. I think Emmerich is a ski instructor as well. So you got your surfing when you got your ski gear. So how about, did I miss, I now I see, how about Dr. Girard? How about you close the session here today with your comments, and you're our star guest as well, Dr. Girard. So you could say that you were interviewed today, go back on your shift today and say you were interviewed by a famous public health doctor in Quebec, okay? That's friends with so look this up, John Frederick Lévesque. He's in New South Wales. He's like one of the top leaders in in innovation in healthcare. Lévesque, if you Google that. He's a colleague of his. So Dr. Girard, what do you think of this session, and how do you want to conclude this?
Well, I think that we thank Annie so much, because it's a bit of Australia that we were able to tackle a little bit. This is a fascinating country for us for a lot of reasons, not just because the Queen. We have a lot more in common, I think, in terms of what we share. I would say that the session today with this paper that you published is interesting. It simulates our medical students, of course. But what we need to recall is that the process is the most important part of that. It means that when you write down a paper as you did, you were on a reflective process. I think that as physicians, as future physicians, we need to be aware about the social role we have dealing with health problems within our communities. And I would say that, of course, I think that from your arguments, from your values, that we could actually touch down better now, Annie. We think that when you wrote down this paper, it was just not for publishing it. It was for another reason. You were able to reflect on this with your colleagues. You were aware of the needs of the people that would have access to this technology. And I'd like to congratulate you, because you are. I know that a lot of professors from Australia University were telling us about their medical student. This is the first time I meet a medical student from Australia, but they were right. They would say to us that our medical students are social accountable to their people. And I understand why, because you make us, you convinced us that you are really on this track. And I think that this is the room we need to improve in our universities. We could come from McGill, from Université de Montréal, from Sherbrooke, or from Laval. I think this is something our medical students are calling. They are the next leaders for our health system, a public system that is probably always at risk to deplete its resources, as our two colleagues that were telling us about the nursing situation, because the public mix, private public mix, is something very, very, we need to take care of that, because it could be a way to deplete resources in our public system, which is not a good idea, of course. So I think that with our future physicians here, we would be able to keep our health system for a very, very nice future. And I think dealing with the pandemics is a good example, the importance to have a public system. If you look back to United States, it's a catastrophe. It's just not about Trump. It's about their system, the way that they were not able to deal with the COVID-19 as from an optimistic view. So I will conclude here, Richard, if you want.
Okay. So, Dr. Girard, once again, thank you very much. Annie Arnold, our star guest today at the Grande Entrevue du Living Lab. It was fantastic. What a joy. We kept you on for more than 90 minutes. You never know what to expect in these interviews. What an amazing moment. You have a brilliant future, and I do hope we'll stay in touch. And lots of ideas and possibly. Please say hi to David Lim,
I will.
supervisor that connected us for this paper. And we wish you all the best, and let's stay in touch.
Thank you very much. It was lovely to meet you all.
You're in for a long day. So
Oh, yes.
Bye-bye. Thank you.
See ya.
Bye-bye. Thank you to all students, everybody who are there, our research coordinators. Thank you so much for being there. Really proud of you all as well.